Hey guys, what's up? Welcome back to the channel. Or if you're new, thanks for clicking. It's Amir Mirkarimi, IFBB Advanced Bodybuilding Training and Nutrition Coach. Real quick before we jump in. This is a straight up educational stuff only. This is not medical advice. Deca or Nandrolone Decanoate is a controlled substance, illegal for bodybuilding use. And yeah, it comes with some serious risks. If you're even thinking about touching this, talk to a doctor first. Get bloods. Know your laws. Cool? Alright, let's get into it. Why has Deca been stable forever in bodybuilding? So, Deca is basically testosterone, but tweaked. It's a 19-nor compound, missing that carbon at position 19. That little change gives it this crazy high anabolic rating like 125 to testosterone's 100, while androgenic sides are way lower, around 37. Means you build muscle like crazy, but less of harsh stuff. Aggression, bad acne, hair loss for lots of guys. It started in 60s. Doctors use it for anemia, bone issues, wasting diseases, HIV patients, injury recovery, legit medical use back then. What it does in the body binds super strong to androgen receptors. Nitrogen retention goes through the roof. Protein synthesis ramps up. Red blood cells increases. And this is huge. Collagen synthesis gets a massive boost. The decanoate ester makes it a slow release. Half-life 6 to 12 days, so you pin once or twice a week. Level built nice and steady. That's why the gains feel different, smoother. Not that explosive dynamo kick, more like consistent progress. Alright, the good stuff first. Why people love it? Muscle and strength, no joke. There is this study, experienced lifters, 200 milligram a week, just 8 weeks. They added average 2.6 kilograms of fat-free mass, basically pure muscle. And placebo group, nothing. In medical trial, wasting patient on lower doses, 3 to 4 kilogram lean mass in 12 weeks. When bodybuilders go higher, eat big, train hard, you're looking at 10 to 20 pounds total over a cycle. And if you do it right, a solid chunks stays after. But honestly, the real reason a lot of guys run Deca, joints feel amazing. Collagen and synovial fluid go up, knees, shoulders, elbows. They stop screaming during heavy sets. Some studies on low test guys, pain scores dropped like 50% in weeks. Users feel it around week 2 to 4. Suddenly, you can squat heavy again without wincing. Recovery gets insane too. Better oxygen from more blood cells. Nitrogen retention means you bounce back fast, recover faster. Appetite usually shoots up, perfect for bulking. And compared to tren or high-dose debo, it feels smoother, less rage, less side like that. Sound pretty dope, right? But let's get real. There is a flip side, and we gotta talk about it straight. Biggest thing, Deca crushes your natural testosterone production, often basically to zero at decent dose. No test base, no proper PCT, you're gonna feel like crap, low energy, mood swing, libido crashes hard. And yeah, Decadic is a thing, super common. Libido tanks, erections weak or gone. Comes from progestin activity. Prolactin can raise, dopamine get messed with, plus no DHT conversion like test gives you. Guys who run it smart, they keep tests higher than Deca, like 1.5 to 2 to 1 ratio. Sometimes throwing cover if prolactin acts up. Don't skip that. Still get some estrogen stuff. Aromatizes around 20% of test, so possible blood gyno risk if you stack sloppy. Heart and lipids, not great. HDL tanks, LDL climbs, water retention can push blood pressure. Long cycle or high doses at cardio strain. Anabolic androgenic steroid side effect reviews. Endocrine issues. Shutdown. Gyno. Fertility drops. Bad lipids. It's over 40% of cases. Cardio problems, right there too. Other stuff, sperm count crashes. Some get that early Deca flu. Mood can swing. Emotional for few. And for women, virilization even low dose. A lot depends on dose, length, how you manage it. Some sites reverse. Some don't if you push too hard. So, how do people actually run it without wrecking themselves? Doses. Beginners 2 to 300 milligram per week. Intermediate 3 to 500 milligrams. Advanced maybe 4 to 600 milligrams. Past that, risk reward gets ugly fast. Pin once or twice a week. Monday, Thursday. Keeps it stable. Cycles 10 to 16 weeks. Most do 12 to 14 weeks. Take 4 to 6 weeks to really saturate. Short run, wasted. Rule 1, never slow. Always stack with test. Classic setup, testosterone enanthate 4 to 500 milligrams, Deca 300 milligrams per week for 12 to 14 weeks. PCT, non-negotiable. Start 2 to 3 weeks after last pin. Clomid Nova, maybe HCG for 4 to 6 weeks. Blood before, mid, and after. Timeline. What to expect if you nail it. Weeks 1 to 4, appetite crazy, pumps better, joint start loosening, early strength grip. Weight up from water and glycogen. Weeks 4 to 8, muscles fill out, size pops, strength jumps. A lot of guys see 20 to 30% on big lift if eating training on point. Recovery feels superhuman. Weeks 8 to 14, peak city, 10 to 20 pounds gains. Good lean portion sticks if you don't crash post cycle. That 200 milligram study, 5.7 pounds lean in 8 weeks. Scale up with more food training. It adds up. But post cycle, if you slack on training, diet, or PCT, you lose a bunch. Low test equal to muscle melt. Genetic, consistency, everything matters. Wrapping up, Deca can give you that full quality look. Joints safe. recovery on good mood, but it's not free. Shutdown, erection problem, heart risks, headache, real shit. The dude who get the most, moderate doses, a smart stack, dialed lifestyle, respect PCT. Most people though push natural heart, training, food, sleep, supplements. You'll get damn far without gamble. What about you? Ran Deca before? Thinking about it? Drop your take in the comments. Keep it chill and smart. If this hit, I like the video. Sub if you're new, bell on, more deep dives coming. Stay safe out there. Train smart. Catch you next one.